A bold vision for healthier kids. But is it enough? The Trump administration has unveiled a comprehensive strategy report aiming to tackle the rising tide of chronic diseases among children. With a whopping 128 recommendations, the Make America Healthy Again Commission, led by Health Secretary Robert F. Kennedy Jr., has certainly sparked a conversation. But here's where it gets controversial. The plan, while ambitious, seems to lack the necessary resources and concrete actions to make a real impact. Kennedy describes the chronic disease crisis as an existential threat to the nation, and the report's recommendations are indeed historic in scope. However, critics argue that the goals set forth are at odds with the administration's other moves, including cuts to vital programs like food assistance and scientific research. Eric Mitchell, president of the Alliance to End Hunger, raises a valid point. How can we make America healthy again if we undermine access to basic necessities like food? The report identifies 4 key drivers of chronic disease: poor diet, chemical exposure, lack of physical activity, and overmedicalization. It proposes an educational campaign to promote healthier eating habits and reduce consumption of highly processed foods, which make up a staggering 60% of children's diets. But here's the catch. While the report talks about defining ultra-processed foods, it fails to outline specific steps to reduce their intake. Susan Main, an epidemiologist, agrees that the plan lacks the necessary resources and direction to execute these ideas effectively. And this is the part most people miss. The report's emphasis on diet and exercise, while important, seems to overlook the role of environmental factors. Chemical exposure, especially from agricultural pesticides and herbicides, is a significant concern, yet the report calls for minimal changes to pesticide regulations. As an environmental lawyer, Kennedy has been vocal about banning certain agricultural chemicals, but the strategy report takes a more conservative approach, merely suggesting an evaluation of current regulations. Furthermore, the plan's call for a new vaccine framework has raised eyebrows. Kennedy's recent actions, including replacing CDC advisors with critics of vaccines and limiting access to the COVID vaccine, have sparked fears of an evidence-based approach being undermined. Senator Patty Murray went as far as calling for Kennedy's immediate firing, accusing him of burning down our public health system from the inside. The report covers a wide range of ideas, from research initiatives to public awareness campaigns. But critics argue it lacks a comprehensive blueprint. Dr. Philip J. Landrigan of Boston College describes it as uneven and disjointed, reflecting Kennedy's preoccupations rather than a cohesive strategy. So, is the MAHA plan a step towards healthier kids, or just a collection of well-intentioned ideas? The jury is out, and we invite you to join the discussion. What are your thoughts on this ambitious yet controversial strategy? Should we be concerned about the potential impact on public health? Let's keep the conversation going in the comments.